Number of kids dying in Virginia is especially high, especially in the southeastern part of the state.
Among the causes of death, abuse, neglect, and unsafe sleeping habits. 13 News Now reporter Ernie LeBeau joins us in the studio with more on the effort to keep kids safe.
That's right, Janet. We're talking about 42 child deaths with various causes. Now, the team that presented these numbers is comprised of health professionals as well as child service groups. Now, their goal is to basically identify and document cases of child deaths and come up with preventive measures.
We do love Harley, and we are sending our best wishes to her family.
In May, people came together in the Ocean View neighborhood of Norfolk to remember 2-year-old Harley. Police say she died after being burned in a bathtub. Her mother and mother's boyfriend are accused of the crime.
There should be ongoing efforts in our region to prevent the deaths of children.
It's child deaths like this that medical and child service professionals came together today to talk about preventing. Michelle Clayton is the medical director of the child abuse program at the Children's Hospital of the King's Daughters. She presented child death numbers from the Eastern Region Child Fatality Review Team. And from July of 2016 to June of 2017, the Eastern Region of Virginia had 42 child deaths. 16 of those were due to neglect or abuse. Majority of these kids were in the care of a parent or caretaker. The report also shows 94% of the children dying in abuse or neglect cases were under the age of 3.
No one agency can look out for every single child. It takes all of us working together to be aware of conditions that may be unfavorable for children.
And that, along with education, Clayton says is key to preventing deaths like Harley's. Now, another factor in these child deaths reports is unsafe sleeping areas.